Hi, it's Dwight, Lab Supervisor for Servium Diagnostics. We have here a respiratory collection that we're going to talk about today. The viral transport media that we use is a four-plex respiratory test. It looks for flu A, flu B, RSV, and COVID. We provide you with these VTM media and VTM swabs. Please only use the materials that are supplied to you from Servium. Our testing methods are validated with only these particular materials. If you send us any other type of swab or VTM media, we will not use it, we will reject it, and you will have to reorder and recollect the sample. Please be sure to have all of your personal protective equipment, PPE, ready before you get started. So if that means a gown and a mask and gloves, that would be great. You also want to make sure that you're protecting not only yourself, but the patient. Okay, so let's get started. When you get the VTM media, it's gonna come in a swab and a container that looks like this. Essentially, what you wanna do, open it up, get your swab out, and you're going to take the swab, tilt the patient's first position the patient in a very comfortable position, then tilt their head back as far as you can. You're going to stick the swab in each nares for 10 to 15 seconds. So that's 10 to 15 seconds in the left, 10 to 15 seconds in the right, and then you should be done swabbing. That's going to be a total time of 30 seconds you'll be in their nose. Once you're done with that part of the procedure, unscrew your VTM media, set it down. There's a little hole here in the cap. You're gonna attach your swab into that hole. You can use a push and sort of a turning method to get it to stay. Once that is done, you're gonna take your media, stick your swab in. There's a little notch here. You're gonna pull back like this. It's gonna break off and drop into the media. Once that is done, you can throw this piece away, screw it up, and there you have your sample. Once your sample is collected, you want to make sure you properly label your sample. If you use pre-printed labels, that's great. We need to have the legal first name, last name, and date of birth. Bonus points if you have the collection time and date. That is important for us to know. If you have to handwrite these labels, same information is needed. First and last full legal name, date of birth, date and time, and collection is a bonus if you can do that. Once the tube is labeled, you're going to put it in a biohazard specimen bag. You're gonna also take the requisition and you're gonna put it in the outside pocket of the biohazard specimen bag. The biohazard specimen bags do have two openings. One is an outside for the paperwork and then an inside zipper lock for the specimens. Please do not put the paperwork in with the specimen. If the specimen breaks or spills in transit, then we don't have paperwork. Everything is ruined. Once that is done, you're going to take this sample and you're going to put it in a lab pack. Mail these samples to us as soon as possible. The samples will have a 72-hour stability after you get done collecting. So as soon as you put the swab into the media, the 72-hour clock starts ticking. Put everything in a lab pack and send it to Servium Diagnostics. If you have any questions, we can be reached at lab@serviumdiagnostics, or you can also call us.